Certainly there's obvious things. Age. The older you are, the more likely you are to have diabetes. The growing epidemic of obesity. Obesity right now, we classify 80% of people are obese in the United States right now. 30 years ago it was 40%, so that's doubled. The third thing is probably the change in ethnicity. If you look at the United States, there's more people of Latino extract and African Americans who have a much higher incidence of type 2 diabetes than Europeans. Anybody that's obese is insulin resistant almost by definition, which means insulin doesn't work as well. So you have to produce more insulin when people are heavier. What happens is if there's some genetic predisposition to type 2 diabetes, eventually the pancreas gives out and just dies and the sugar goes up. So if you can get those people to be thin, for instance, we do gastric bypasses on people, they lose a tremendous amount of weight, their diabetes often goes away. So it's because you need more insulin, and just like a car, what happens after a while, there's not enough gasoline and the car stops. No matter what you eat, you can't eat too many sugars and get diabetes. That's what your mothers used to tell you, eat too much, you're going to get diabetes. That's not true. It doesn't, there's no evidence of that. That's number one, that by far and away. And that's very damaging, because when you just have a newly diagnosed patient and somebody tells them, you can't have that, you can't have ice cream, you can't have that, that's completely wrong. Everybody lives on sugar. And I mean, it's the only fuel that we have. The brain has to have sugar. That's the number one thing that people tell people you can't eat that. They can eat anything they want. There is no diabetic diet anymore. There's no one diet that works. The question becomes, and it's a big question, whether or not low carbohydrate or low fat is actually best for weight reduction. There was a study recently in New Orleans which got a lot of publicity where they looked at low carbohydrate versus low fat, which was better for weight reduction. And lo and behold, it was the low carbohydrate that actually led to more weight loss in these people. And actually they developed less diabetes. This was actually a preventative study. So it's quite interesting. Nobody has a good idea yet, but we're going away a little bit from the low-fat diet is making people lose weight. Maybe we have to look at carbohydrates. For instance, I'll give you another example. If you look at diet sodas, diet drinks, they're NutraSweet or whatever. There's no calories in it. But yet there's a good evidence that people that drink a lot of low-calorie beverages get more diabetes. How could that be? Well, the reason is because we're giving the body a false sugar, and the body has to have sugar, and it craves sugar. So it increases carbohydrate uptake, or how much they eat, and it leads to more diabetes. A novel thought. How can you take something there's no sugar in it and it causes sugar? Interesting, huh? Not what you think. Oh, it's a major impediment. There's no question about it. When I was working in Harrisburg with the Randall Commission, that's what we were looking at. How are we going to lower the cost of diabetes care? Because if you look at insurance companies, they put out an incredible amount of money in diabetes care now. Insulin, for instance, a bottle of insulin used to be $10, $20, now it's $180. So a lot of people can't afford the medication that they need to treat their diabetes. We talked about diet. It's a lot cheaper to buy high-fat food than it is good food. I mean, think about Whole Foods for a minute, how expensive it is to shop there. I mean, you're not going to get everybody to shop there. The insurance companies also are not as amenable to treating things as they used to be. They block a lot of the things that we like to give people. And in other words, you might do a research on the X drug that might help people. Can't get it. I mean, they just won't give it to people. So it's very expensive, but the way I look at it, it's expensive to treat, but it's much more expensive when they get sick. Some people have looked at, for instance, if you look at colder climates, people get more diabetes. Why would that be? Are they fatter? Sometimes yes, sometimes no. A lot of it's probably genetic. People have looked at vitamin D, the sun. You know, we talk about climate change and things like that. If you look at vitamin D, and the higher the amount of sun is, the higher the vitamin D. If you look at that correlates with diabetes as well. The more vitamin D people get, the less diabetes they get. It has something to do with insulin resistance. As you know, a lot of us are involved with rails to trails. You know, we've tried, on the good side, we tried to make more bike lanes. You know, look what's happened in Pittsburgh. Plus, there was a fear about bike lanes, but we've tried. Those are actually environmental factors that you can change. More people riding bicycles, more rails to trails. So there's a lot of things. Nobody has found one thing that really points to diabetes completely. In almost every country, no matter what the environment is, the climate, there's an increase in diabetes around the world now.